The chapter I'm going to talk about is pediatric voice disorders. A little background here. Pediatric voice is unique because of shorter vocal folds, smaller larynx, smaller subglottis, and etc. But the most important feature is that the vocal folds are lacking differentiation of layers until the children reach age 12 or 13. That means treatment strategies, surgical approaches, and response to healing may be different from those of adults. That's why knowledge about the growing larynx is necessary for optimal treatment. Assessment. Assessment includes history, directed physical examination, voice assessment, instrumental examination, and maybe some further testing if applicable. A few highlights here. We need to ask about the child's living conditions at home and in school, and we need to figure out if they have exposure to tobacco, fume, or chemicals. And if the kids is a young singer, we need to know as well, because vocal fold disorders are not uncommon among children with avocational or professional voice use. Here's a list of pediatric voice disorders. The most common disorders are vocal nodules, vocal fold cysts, and anterior glottic web. There are a bunch of other disorders. They can be functional, they can be congenital, they can be neoplastic, they can be neurologic, depending on how you categorize them. Vocal fold nodules. These are the most common cause of dysphonia in children. Nodules are symmetric fibrotic masses on the surface of the vocal folds. The voice quality is hoarseness. They can be a result of vocal abuse or misuse, but we don't understand the exact events leading to nodules yet. Vocal fold nodules may co-occur with muscle tension dysphonia and/or laryngopharyngeal reflux. The treatment is usually vocal hygiene, voice therapy, and behavioral management. The key is to remove vocal strain. Vocal fold cysts. Cysts can be acquired or congenital. They can be mucus-filled or epidermal. Cysts can be difficult to tell from nodules, as there is often a reactive vocal mass on the opposite side of the cyst. Cysts usually do not resolve with voice therapy. That's why surgical removal is usually required. Anterior glottic web. The anterior glottic web can be congenital or acquired. Some children with the web do not show symptoms at all, but some are dysphonic. If a child is dysphonic, it's probably because the web interferes with airflow across the vocal folds, preventing the mucosal wave from spreading, and probably because the web interferes with glottic closure as well. A web that causes airway obstruction and hoarseness warrants surgical intervention. The treatment is surgical removal, as well as placement of a keel to keep the edges from rescarring together. That's all. Thank you for watching.